Welcome to the Sci-Fi Evolution channel. Galactic physician Arden Flint realized early on that the key to successful field surgery lies in emotional detachment from patients. The 3 years spent aboard the Solaris 9 orbital medical station reinforced this lesson in countless emergency situations where procrastination could mean death and attachment could mean professional burnout. And so, when an alien nurse with purple skin entered his intensive care unit at 3 a.m., moving with a grace that made experienced medics seem awkward, Arden told himself that his sudden admiration was purely professional. "I'm informing you, 17 injured after the collision in the Galadon system, all of different types," Nurse Zelfina announced without preamble, her accented voice sounding harsh and authoritative, like someone who has seen too much blood for her age. "Arrival in 4 minutes." Arden was already nodding, pulling on his surgical gloves. The sorting process was standard. However, it is worth noting that 6 of the injured are Krisians, and their anatomy. It is important to pay special attention to the secondary circulatory system, especially the reserve hearts, she continued. He began to prepare the tools. His subconscious mind took over, while his conscious mind tried not to notice how her pointed ears twitched when she was focused. "Is there anything else I need to know about the patients?" he asked. 2 people with plasma burns, the extent of which is unknown. 3 Valdorians have shrapnel wounds, and 1 non-Korean pilot may have suffered a head injury, she replied. The doctor moved around the compartment with the grace of a dancer, deftly arranging the equipment with many years of experience. There was also an unidentified species among them, which the medical team was still trying to identify. "Great! A mysterious patient at the beginning of the shift!" exclaimed Arden. He activated full-spectrum lighting in the intensive care unit, replacing the soft background light with a more focused medical one. "Have you worked with unidentified species before?" "I've worked with 17 different physiological types," Zelfina replied, her golden eyes meeting his for a moment before returning to her preparations. "Are we a mystery?" asked Arden, genuinely surprised. "You are the ones who have reserve organs and bones that regenerate at the cellular level," she explained. "Yes, but your kind approaches medicine like it does war. Sheer aggression and overwhelming force. You cut, cauterize, and bombard with chemicals until the problem disappears," Zelfina said. She paused in her preparation, studying him with an expression he couldn't read. "It's effective, but not elegant. Sometimes an elegant approach works, but elegance leads to the death of people," he said, immediately regretting the defensive tone. "Sorry, it's been a long day, a long war," she corrected gently. "And I didn't want to criticize. Your methods save lives. I've seen it many times during our shifts." This remark caught him off guard. He didn't realize that she was watching him. "I've been watching your work closely to form an opinion about your technique," she said. "It's hard not to notice someone whose hands stay steady while others are panicking," she said simply. "Medical precision requires a special mindset that I find interesting." Before Arden could respond to this ambiguous statement, the doors of the compartment swung open, admitting a controlled chaos of arriving wounded. The conversation was interrupted, replaced by professional concentration, but something in her words remained like a haze on the periphery of his consciousness. There was silence in the intensive care unit after the emergency, when Zelfina approached Arden with a clinical curiosity that usually precedes either groundbreaking discoveries or spectacular medical disasters. In her hands, she held a small device that looked like a cross between a medical scanner and an alien flower. "I was wondering," she said, putting the device on his workstation. "Diagnostic methods in humans are highly dependent on technology, not on feelings. We lack the enhanced perception that your kind possesses, or to be more precise, her delicately pointed ears. Instead, we compensate with superior tools. It confuses me. How can we detect emotional trauma without the ability to read bioelectric fields?" How can we assess pain levels without feeling neurochemical fluctuations? She took one of my standard scanners, twirling it in disbelief. This device can detect cell damage, but it cannot assess a patient's psychological state. We rely on asking them, as Arden suggested. It's an innovative idea, I know. But what if they can't answer? What if they are unconscious, or their speech centers are damaged, or they simply refuse to admit their weakness? Then we have to guess and hope for the best. I watch her study my tools with such zeal that I want to help. He considered her words. I have to ask, where does this sudden fascination with human medical theory come from? I may have misunderstood your approach. She nodded, her skin turning a little more purple, which betrayed her embarrassment. Yesterday, when you treated a non-Korean pilot, you spent 17 minutes talking to him before proceeding with any medical procedures. He was visibly worried. Non-Koreans often experience claustrophobia in confined medical settings. Indeed, but how did you come to this conclusion? There is no mention of psychological problems in their medical records, he said. Arden shrugged his shoulders. His gaze was fixed on the exits. His breathing became ragged. It's a matter of simple observation, she mused. You diagnose psychological trauma through behavioral analysis, rather than relying on technological scans. Is it unusual? It was amazing, she said, and the admission seemed to surprise her as much as it did him. If my colleagues were here, they would have immediately sedated and started treatment. They would eliminate the physical symptoms, completely ignoring the emotional root cause. Well, come to think of it, we both seem incompetent at our jobs. Arden took her scanning device, admiring its organic curves and the way it seemed to pulse with its own heartbeat. Do you mind if I ask about his work? It's a bioresonance scanner, she explained. It detects electromagnetic patterns of living tissue and translates them into sensory data. She came closer, touching it as she adjusted the device's settings. For example, if I were to scan you right now, it would show that your stress hormone levels are elevated and your cardiovascular system is responding to intimacy stimuli. The stimuli of intimacy. You find my presence stimulating for your nervous system, he corrected. To be honest, the tips of her ears have acquired a faint pink tinge. Although the readings were unusual, most people show fear or curiosity during the scan. However, your pattern suggests something completely different. Perhaps your scanner is malfunctioning, Arden suggested uncertainly. She assured him that he was working properly. This raises intriguing questions about people's emotional reactions to extraterrestrial contact. Or perhaps it raises questions about a particular person's reaction to a particular alien, he found himself saying. He immediately regretted his words. Zelfina looked at him with her golden eyes, her expression changing from professional curiosity to something more personal. That, she said softly, would be a fascinating subject to explore. The emergency operation was a disaster from the very beginning. A Terran soldier with internal bleeding caused by shrapnel wounds, aggravated by an allergic reaction to standard blood-thickening agents. Zelfina assisted during the procedure, and in the chaos she was elbowed in the ribs. Trying to hold the surgical field, she lost her balance from the sudden movement. Despite her insistence that she was fine, Arden noticed that she was leaning on her left side and moving her arm carefully. The patient's well-being came first, and Arden explained that the patient was stable and had been sedated to a state of peace. However, Arden noticed classic signs of soft tissue damage and possible dislocation of the joint in Zelfina. Arden interrupted Zelfina's request for an examination, saying that they were too primitive to understand alien physiology, or that she was too stubborn to admit her injuries. She opened her mouth to protest, but closed it again, narrowing her golden eyes as she changed her mind. Both. Right. On the examination table, Arden gestured to the nearest medical bed, switching to full medical mode. Before you object, Let me remind you that you've been lecturing me for the last 3 weeks about proper patient care protocols. This is different. How is this different? She paused, her ears twitching with obvious annoyance. I'm not used to being examined by someone whose hands move with such deliberate tenderness. The statement hung in the air like a challenge. Arden felt a shift in his chest, realizing that it was not just about medical care. Would you prefer a more forceful approach? She asked, but still climbed onto the examination table. My people prefer direct action rather than prolonged reflection. Sometimes prolonged reflection can prevent complications, Arden said, activating his scanner. Please roll up your sleeve. She obeyed, exposing her purple skin. Arden noticed a discoloration on her shoulder and upper arm, resembling thunderclouds. The bruises were striking in their own way, dark purple against her natural skin tone. However, as a professional, he recognized the signs of severe injury and asked, "This is more serious than you first said." He began his examination with gentle pressure to assess the extent of the injury. "Why didn't you mention it earlier?" she replied. "Medics don't have the luxury of being injured during emergencies." Her voice trembled slightly as his fingers found a particularly painful spot. She continued, "Medical staff are not invulnerable simply because they care about others." His hands moved with expert precision, checking for fractures and dislocations. It was a skill he taught to every medical student on their first day of training. "Learning and practice are two different abilities," she said, then took a deep breath as he turned her arm to check her range of motion. He apologized. His touch was gentle. Becoming even more gentle, she asked if anything was causing significant discomfort. "His inspection technique was pretty thorough," she remarked, her tone carefully neutral. This was very different from standard medical procedures. She noticed the way he touched her, as if he was afraid of causing harm rather than just assessing the damage. She studied his face as he worked, his golden eyes reflecting something she couldn't quite place. Most field medics acquire a certain rigidity, but there seemed to be something about him that emergency medicine often destroys compassion that transcends professional obligations. The medical bay was plunged into the pre-dawn calm. That serene hour when even the most restless patients finally succumbed to the embrace of healing sleep. Arden completed the assessment of Zelfina's injuries with the same meticulous precision that earned him recognition in 3 different military medical units. He noticed that her bruises were more extensive than he had initially thought, spreading across her shoulder and down her arm in patterns indicating a significant injury from a blow. "There are no fractures," he said, applying a healing gel that will speed up tissue repair. "However, you must limit your movements for at least 2 days. Deep tissue damage takes time to heal properly," Zelfina replied in a dry tone. 8 hours of limited duties during a medical emergency. The irony did not escape Arden. The irony was that they were losing their best trauma nurse because she was too stubborn to accept proper treatment. Arden expertly applied bandages to Zelfina's arm. "I'll leave you some painkillers," he said. "They should help ease the pain while you're recovering." "Arden," Zelfina said, her amusement obvious. His gaze lifted from his work, and he found that she was studying his face with such depth that his scanner readings suddenly became irrelevant. "It's just good medicine," he said. She replied firmly, "No, good medicine treats diseases effectively. What you're doing is more than that. You treat people as if their comfort is just as important as their recovery. Doesn't this seem like good medicine to you?" For him, it was like that. But most doctors are learning to separate emotional care from physical treatment, as this is considered a necessary boundary in traumatology. Her voice softened, becoming more personal. "That's what I meant earlier," she continued. "Your touch is too caring for someone who has been trained to work fast and move on. Too gentle for a soldier who had to learn emotional detachment." Arden felt a change in the tone of the conversation, realizing that they were no longer talking about medical procedures, but about something more intimate. Maybe I just, terrible soldier, perhaps you are exactly the healer that this conflict needs, she replied. Someone who remembers that under wounds and injuries, we treat people who deserve compassion. The healing gel emitted a faint glow under the patches, casting a soft light on her purple skin. In the calm atmosphere of the medical bay, surrounded by the gentle hum of life support systems and medical equipment, they sat closer than professional protocol allowed. Your injuries will heal completely in a few days, Arden said, his voice barely audible. However, I must personally monitor your progress. I would appreciate a comprehensive follow-up, she replied, her hand covering his as he rested on her shoulder. From someone whose gentle touch I've learned to trust. Zelfina, he said, her name sounding like a revelation on his lips. Yes, he said, when this war is over, when we are not surrounded by injuries and emergencies. The doctor smiled, his expression radiant and warm, completely different from the reserved professional manner he adopted during emergencies. I believe, or perhaps I'm starting to realize, that you just prescribed exactly the treatment that we both need.